Good afternoon, everyone. I'm Sulasri. I'm come from Polytechnic Kesehatan Tanjung Karang. I want to present our research about psychological problem of nursing students in clinical practice during the COVID-19 pandemic. Psychological problems are conditions that are difficult to avoid. Any stressor to appear will trigger the emergency of stress or other psychological problem. COVID-19 is a pandemic attacking all levels of society, especially hard workers who have to deal directly with patients. Nursing students in achieving their skill have to do clinical practice. Of course, that will also be affected. Currently, the vaccine is available. Most people have received the vaccine, but is that not guarantee that someone is not infected? Strict health protocol must be followed. However, transmission still occur and cause many victims, especially from hard workers. This condition, of course, a sporadic concern that triggers psychological problem. There have been many previous studies that have highlighted a psychological problem in hard worker, but not much has been done to study the result of the survey on nursing students, especially from Tanjung Karang Hub Polytechnic and Nursing Universities Riau have confirmed that many students have COVID-19. In general, those who have been infected still feel anxious about being infected again, and those who have not been infected will be infected. It's been almost 2 years since the COVID-19 pandemic has hit the whole country. The vaccine has been given, but transmission and victims are still happening. By interviews, studies like learning clinic offline, 100 worry impacted. Applied to location practice like side body fevers, sick head, and complaint physic, other if think about obligation as student, like psychosomatic. Study literature condition psychological student in the COVID-19 pandemic already many done. However, for learning clinical not yet done. Support program Safe Community Mendu study on disaster non-natural COVID-19 pandemic identification condition psychological student in best practice clinic nursing during the COVID-19 pandemic. Mental disorder for this condition from mental disorder after trauma, like response trauma due to disaster, last 2 weeks until 2 years. The initial response is acute stress to depression and post-traumatic syndrome disorder. Other disturbance can be acute stress reaction occur from the beginning of the disaster up to 1 month. Giving occurs from the beginning of the trauma or disaster until 6 months. Depression start from 2 weeks of trauma. 1 month after trauma, often found anxiety disorder and post-traumatic syndrome disorder. Research purpose, this purpose of this research is now the condition of the psychological problem of nursing students in conducting clinical practice during the COVID-19. Research method, the research design applied is a survey. The sample used was nursing students who underwent clinical practice during the COVID-19 pandemic. As many as 150 respondents from the Tanjung Karang Hub Polytechnic and the Faculty of Nursing Riau University. The variable studies were student psychological problems. The measuring instrument for collecting data used the self-reporting questionnaire 20. Univariable analysis psychological problem is in respondent by table distribution of mean, median, standard deviation, and minimum until maximum value. Result study of characteristic of respondent On age, Latin 145 or 96.7, early adult 2 or 1.3%, late adult 3 or 2%. Based on the table 1, it can be seen that most of the respondents were in their late teens, about 17 until 25 years, as many as 145 people or 96.7%. Characteristic of respondent based on gender: men about 17 or 11.3, women about 133 or 88.7%. Based on the table 2, it can be seen the most of the respondents were female, as many as 133 people, about 88.7%. Description of respondent characteristic by education level: education diploma 3, about 31 or 20.7%, diploma 4, 51 or 34%, and profession or nurse about 68 or 45.3. Characteristic of based on psychological response or anxiety: worry about 68 or 45.3, no worry 82 or 54.7. Based on the table 4, it can be seen that most of the respondents did not feel anxious, as many as 82 people or 54.7%. Overview of characteristic respondent based on depression response: depression about 57 or 38%, no depression 93 or 62%. Based on the table 5, it can be seen that most of the respondents did not show a depression response, as many as 93 people or 62%. Characteristic respondent based on the acute stress response: stress 53 or 35.3%, no stress 97 or 64.7%. Based on the table 6, it can be seen the most of respondents did not show a trauma response, namely 97 people or 64.2%. Characteristic of respondent based on problem response: psychological, even psychological 87 or 58%, no problem, 63 or 42%. Based on the table 7, it can be seen that most of the respondents show the psychological affected response when conducting clinical practice during COVID-19 pandemic, namely 87 people or 58%. Problem psychological is problem which no could avoid on condition COVID-19 pandemic, especially student which do practice clinic. Result study: 43.3 students experience worry light. 56.7 students experience worry currently. Public respondent experience problem psychological 64.7%, and public experience trauma 83.5%. Study previously worry student which currently do. Essay in University HKBP Nomen Sen Medan, there is 23 or 7.3% on worry low, 215 or 75.1% on worry currently, and 79 or 17.6% on worry told by general worry study more many on category currently. Worry influence results study student then experience confusion and distortion perceptions. Worry which prolong and by continuously stress until depression. Study in university in TB from 235 respondents, public experience worry like as much 99 or 22.13%, and worry currently as much 38 or 16.17%. Respondent which experience stress like 60 or 29.53%, and who experience depression like as much 14 or 6.38%. Consequence learning online. Result study problem psychological the most many experienced by student because learning online that is worry. Stress and worry reaction to situation which written and not expected. Reaction stress change concentration, quick angry, worry, difficult sleep, decreased productivity, and conflict interpersonal, next experience condition mental, which more critical as separated self from family. Situation abnormal, enchantment exposure, right will transmission COVID-19, feeling fail and handle good prognosis bad. Officer health which experience difficult maintain condition health, physical and mental risky experience, disturbance psychological like depression, worry, stress, happy, and fatigue. Factor rise other like feeling not supported, worry about health personal, upright bring infection and transmission on member family or other, isolated, feeling no concern, stigmatization, social, burden work which exercise and feel no safe when give service, maintenance and health on patient COVID-19. Well-being psychological is condition where aspect psychological somebody could working by good and positive. Panelists will being psychological foreign which own role double in COVID-19 pandemic period. That's pandemic COVID-19. This better well-being psychological like stress, upright, and worry. Psychological problem are an avoidable condition due to the COVID-19 pandemic. Various conditions of uncertainty experience trigger prolonged stress virus undergoes mutation like second wave has a more severe impact. Vaccine have been found and most the health worker, including nursing students, have not been guaranteed not to be infected with COVID-19. Thank you for attention and good afternoon.